Hello, hello, hello. Happy Friday. Thank you for coming to Friendship Fridays. It's Giovanni G, your favorite bestie, to help you navigate this thing on being a caregiver and being prepared when it goes left. So you won't be operating in crisis mode because I've already done that for you. Thank you for joining me today on this Friday, giving me 30 minutes of your time. This is my fourth episode. And tonight we're going to talk about getting your insurance in order, the things you need in order to make sure you alleviate the cost, which we talked about last week, which was getting your money in order. And so we're going to roll up our sleeves and go ahead and get into it. And I'm here every Friday at 9 o'clock. So make sure you like, share, and subscribe. It's free. And if you have any questions, go ahead and just hop in the chat and put your questions in the chat. All righty. So, and of course, if you miss it tonight, you can always watch the replay. Replays is always there. So let's go ahead and roll up our sleeves and get into it. Insurance is the beast that you must learn ins and outs of to be okay within the system. It's a whole lot of fine print. So you could be purchasing things that you didn't even know that you thought you was covered, but once you go through all the fine print, you find out that you wasn't even covered for, right? So I'm going to break down the different insurances that you would need, the different types of insurances that are available, and then we're just going to just navigate the whole thing so you know exactly what you're getting into. So Medicaid is an income-based health insurance that's ran by the state as well as the federal government because the federal government gives the state money to run their Medicaid programs. But Medicaid, when you're elderly, and you start moving assets around, they have a 5-year look back. And so it begins on the application of your long-term care Medicaid. So some people start getting rid of all their assets when they get sick because, like I said, insurances don't cover it. But if you're on Medicaid, because you're low income, you can then get certain things that most people can't get that are quote unquote middle class and upper class. So they get rid of their assets, they sell them off to their kids, they give them away. And so Medicaid has a program in place to prevent fraud, so to speak, because it is technically fraud because you got rid of all your assets so you can get on free insurance. And so it begins the date of your application. So you did your application in September, it's 5 years back from September 2024. And sometimes they can go a little bit deeper than that because it just depends on if you had a whole bunch of stocks and all of a sudden you have zero, or you had a whole bunch of properties and all of a sudden you don't have any. Um, and it's in order to meet your asset limits. So some people get rid of their assets to be within the cap and guidelines of Medicaid. Like I said, it's per state. So each state has a different threshold that you have to be under in order to be eligible. And so some people just get rid of all their things, give their home to their grandkid, give their car away to charity, anything so they can get long-term care for free. And once it's discovered that the assets was transferred within that time period, you can incur a penalty, you can be fined, and you also can be ineligible for Medicaid benefits, period, like lifetime ineligible. Medicare is once you're 65 and older, you purchase insurance. It's a federal government insurance. Your job that you retire from releases you, and you go over to the Medicare system. And so that plan, it is you pick certain things. It has Part A, B, and D. Part A, it pays for inpatient hospital care, critical access hospitals, skilled nursing facilities, medical specialties, and rehab services. So learning how to walk again, that type of rehab after you break a hip, or like my mother had a stroke, those services, those type of facilities, Part A covers. Part B, it covers the doctors and the actual healthcare providers, outpatient care, speech therapists, physical therapists, and occupational therapists, home health, durable medical equipment such as wheelchairs, walkers, hospital bed, and other equipment, and oxygen. Now, when they cover these things, some things, like I said before, you may not get everything. So you may have to choose. So with my mother's case, she was able to get a wheelchair, but she wasn't able to get a walker. That wouldn't have been covered, right? It does not cover, Part B does not cover vision, dental, or hearing. So glasses, dentures, and hearing aids are not covered at all, and they must be paid out of pocket. Okay, so I'm gonna say that again for the people in the back. Your dental, your vision, and your hearing is not covered at all in Medicare Part B. Okay, and that is an out of pocket expense. So if your loved one needs dentures, if your loved one needs hearing aids or glasses, they will have to pay for that out of pocket. And hearing aids and dentures are not cheap. They're not cheap at all. Preventable services such as screenings, shots, vaccines, and wellness visits are covered by Part B. This is where it gets a little sticky. Part D is the prescription piece of it, right? And it covers brand, name brand, and generic drugs, but it does not cover anything with fertility, anything erectile dysfunction. So, no Viagra. It does not cover Viagra. It does not cover weight loss medicine, cosmetic medicine, or cold and flu. All of those things are out of pocket. But Part D is the one you can opt out of, right? So if you decide, like my mother's case, oh, I don't need to take any medication. I don't take medication. I don't need it. I'm going to be holistic. The federal government will then penalize you when you decide you need medicine, not decide, but are forced to get medicine. So once she had her stroke because she opted out, she had 3 years of not having Part D. So she accrued a lifetime penalty of Part D. It comes up to about 30 something dollars a month, plus your insurance fee that comes out of your pension, which is Medicare, it comes out your pension, plus the insurance plan for prescription. So we have Humana, we pay Humana separate. Medicare automatically comes off of your pension. So anyone's pension that has retired, Medicare comes off the top. Okay, even before you send the money. So you will never have lapse in coverage, right? And then they also do the penalty on top of that. Okay, so the penalty is going to also come out of your pension, and it's for the rest of her life. I know that's crazy. That's insane. But yeah, so that's what happens when you opt out of Part D. A and B is automatic. You can't say you don't want one or without the other, but they allow you the option to opt out of Part D. And if you opt out of Part D, they will penalize you once you're forced to have to get it. Um, So, rehabilitation breakdown has maximum days, right? So, an acute rehab is once you break your hip, you have a stroke, have surgery, something where you have to learn how to walk again, it's acute. That's from the hospital straight to that first step of rehab, right? You're only allowed 10 to 14 days there. Okay. So up to 10 to 14 days. So they can discharge you, meaning your insurance can stop paying at day 9. They can just randomly say, well, she don't need no more. Okay. And then your next step down unit is subacute rehab, right? Well, let me go back to your acute rehab. Your acute rehab offers high intensity therapy, right? And you do it 5 to 7 days a week, and it's for 3 hours per day. So that's your physical therapy, your speech therapy, and your occupational therapy. And in some cases, you will have music therapy. With my mother's case, because she had a stroke, music therapy is on the opposite of side of the brain. So even though you may not know how to speak, you can still sing words to songs. That was kind of amazing. I was like, oh, wow. So sometimes they would have a music therapist come in and they would play her favorite artist, and she would either hum the tune or she would actually sing the words, but she couldn't speak. So that is all covered under Part B. Okay. Part A and B, because it's the facility is A and the actual therapist is B. Okay. Okay. So you can't be there no more than 14 days. The insurance will, of course, stop paying and you will have to leave the facility. There's no extensions or nothing like that. Okay. Then you go to a semi acute rehab, which is a step down unit. And it's intense as well, but it's not high intensity as the one before. Your therapy are no longer 3 hours a day. It's more like 30 to 45 minutes per session. So you're getting about an hour and a half of therapy. So each therapy, your speech, your occupational, and your physical is broken down and is crunched together. Okay. And it depends on your actual needs. So if you need more physical therapy, you'll get more of that. Right. And you are only allowed to be there. The cutoff days for there is 100 days. Right. So if you don't have, if you're not well enough within 100 days, you can the at that point the whole this whole facility is only paid 80% Medicare, right? And the other 20%, either you're going to have a secondary insurance, which I'm about to talk about, or you would have to pay out of pocket, right? The 20%. So if the daily rate is $200 a day, which my mom's facility was $200 a day, that was $1,400 a week. Yeah, that I would have to pay out of pocket because the copay is considered a 20% copay, right? But luckily, because she was a teacher, she had a secondary insurance. Okay. Now, once you get to your 100 days, you can possibly, now again, it's up to 100 days. So they can kick you out way before then, right? And they can say, oh, we're not paying the whole 80% anymore. And you got to pay all of it out of pocket. But you can do an appeal process. So you can appeal to Medicare, tell them why you think your loved one needs to stay there longer than that time. And during that appealing process, the person actually stays at the subacute facility. They're not able to kick them out until that whole process is done. But the main objective is to get a bed, right? It's just like the hospitals where they discharge you fast, the turnover is fast because they need those beds. So, if you feel like your loved one is wronged or you feel like they supposed to have more days or whatever, I would highly recommend you appealing because at least it gives you the process and you state your case, they state their case, and then a decision is made. Now, granted, they may still discharge you, right? But at least it bought you 2 weeks time, 3 weeks time to get whatever else in order. So but when it comes to that 100 days, this is the trick. You don't want to use up the whole 100 days. Let me tell you why. Because Medicare has a recharge portion. So the recharge is you can 60 to 90 days of no incident unless it's a new health incident. So, with my mother, she had a stroke, right? So, she couldn't have anything that would cause her to go back to rehab unless it was something new. Okay? If it was something still stemming from the stroke, she would not had any more rehab days. Okay. So that's the trick. So you got to give it time to recharge. So instead of me doing the whole 100 days, I took her out of the facility at 94 days. So then I can have 6 days just in case something happened to kind of hold me to figure out what the plan was going to be. As I told you guys, I have been operating in crisis mode for a long time. It is a year tomorrow. Her stroke was a year ago today on September 14th of 2023. So I made sure not to exhaust all the days. By the grace of God, we hadn't had to go back to the hospital. Um, which was a blessing. We haven't had any life medical crises in that time. So we are fully recharged in the event something happens, but we're hopeful that nothing else will happen. And so they can force you to pay out of pocket, right? So You never want to max out your days. Never max out your days. And if you have really good insurance, right, the facility is going to want you to max out the days because, of course, they're getting paid. It's guaranteed money. So I had to do my due diligence and my research to make sure. I'm like, why are they pushing so hard for her to stay the whole time? And then that's when I found out that's why they wanted, because it's guaranteed money. She had secondary insurance with the teachers union as her secondary, and then she had Medicare with her primary. So they was guaranteed getting 100%. They didn't have to wait on me, miss payments, bounce checks, none of that. They had to wait on none of that. So of course they wanted her to stay. Okay. Now, like I said, if she has a new medical event of hospital treatment for at least 3 days, so the person will have to be admitted. They will have to stay for 3 days at least, and they cannot be evaluated. It can't be observation. So when sometimes you'll hear the doctor say we're going to hold them for observation, that doesn't count. So you'll have to pay out of pocket. Okay. So you have to make sure if they do have a new medical event that they are admitted and being treated, not being observed. Because so that's the kind of way they wiggle out of it, of not covering it. That's how the insurance won't cover it. Okay. Okay, so your secondary insurance, it's called supplemental plans for Medicare. It's also called Medigap policies, and it's just extra insurance. It's like when you get gap insurance on your car and you have a luxury car and you want to make sure if somebody hits you or whatever, it's enough money to cover in case that person didn't have insurance. Yes, you have full coverage, but you want to have enough to be able to purchase another luxury car. So it's gap insurance, same thing, same concept, right? It is extra cost. It comes out separately, but it's something that you definitely should have. If you have a pension, if your loved one has a pension, it also comes out the pension, right? So you'll never have lapse in coverage or anything like that. Okay, so now here are insurances that you need before a medical event happens. Okay, before a medical event happens. Because if you have a medical event, you cannot qualify for these insurances thereafter. Okay. Okay, so long-term care insurance, I highly, highly recommend. I do not work for a long-term care insurance company. I am not getting any kickbacks, but going through the experience I went through, I recommend everyone, whether you're young, you're old, is something that you have. Once you start approaching a certain age, I recommend you get it. Of course, the younger you are and you purchase it, the better off you'll be because the rates will be lower, and you'll make sure that you qualify. So I know people may be thinking, oh, the pre-existing conditions, this ain't got nothing to do with that. These are added plans. So your main priority health insurance, yes, they're not allowed to do pre-existing conditions, but all these supplemental plans, they are still allowed to. Okay, so just keep that in mind. So of course, the younger you are, the younger your loved one, your parents are, um, make sure they get a policy. So like now, if your mom is 60, 55, 60, she's pretty healthy, she worked out, no heart attack, no cancer, anything like that, go ahead and get moms a long-term care plan because that helps with the cost of assisted living. Okay, because assisted living is not covered on any insurance but this one. Okay, and so it just depends on how high of a plan you want to cover it. Like I said last week on Get Your Money in Order episode, make sure you check it out if you haven't. It is $4,500 average for assisted living. It can go as high up to $8,200 a month, depending on the amenities at the facility. If it got a spa, if it has a beauty salon, if it has yoga classes, all these different things, it adds up. So you want to make sure to get the long-term care insurance so it can help you cover the costs. Okay. My mother's was $4,500 a month. That was not including my bills. That was not including student loans. That was not including car note or my kid. That was just her bill alone, not to mention the bills that she had in financial that she had in Philadelphia. So we are your money as well as Georgia money. So I would really recommend you get long-term care insurance. Okay. So in the midst of this, cleaning out her home, I ended up finding paperwork where she opted out. It was $65 a month the plan would have paid out $1,600 a week. $1,600 a week. So that would have helped substantially because she spent almost, yeah, she spent the 100 days in the rehab. So all of that money would have been sitting there building up. And then once she moved into assisted living, of course, it would have stopped, but we would have had a chunk of money to be able to use for that. So that's why I recommend, highly recommend you definitely sign up for long term care insurance. Hospital insurance. So this is your Aflacs, different plans, State Farm has it, etc. This insurance covers hospitalization because even though you're hospitalized, you still have bills and obligations, right? You have stopped working. My mother was still working, so all that money stops. Okay, so they have plans to where you have to make sure that you read the fine print. Any insurance you're dealing with, you have to read the fine print because you have to make sure that sickness is covered. Because sometimes hospitalization may cover just accidents. You break your knee, you break your hip, you need a knee replacement, etc. But it may not cover cardiac arrest, stroke, cancer, and etc. Right? So make sure you read your fine print and also add those things on because sickness may help happen to you and it may affect you. So why not have that coverage just in case you do need it, right? And so this will help you alleviate that cost of being sick because there is a cost of being sick. Okay. And you'll get a lump sum check once you're discharged from the hospital. And you can use it for anything. You can apply it to your past due bills. You can whatever you're trying to do with it. You can hold out, use it to live off of so you don't have to go back to work right away while you're recovering, whatever the case may be. Once you're discharged from the hospital, you actually get a lump sum check and you just upload all your paperwork, your discharge papers, and etc. And they actually cut you a check. I personally used it when I had my daughter. It was a plan that I got and didn't realize that it will actually cover childbirth. So I had a C-section and it covered me. So I had a nice little check that helped me get started being her mom. Okay. So um, this recently just happened last week, actually. Something came in the mail and it was hospital insurance. So I was so excited because I was like, yes, my mom had hospital insurance that I didn't know she had. This is amazing. So I gave them a call, I gave them a policy number, and the lady on the phone said, oh, yes, she did have insurance, but it's only for an accident, a trip, or a fall. Wait, what? Yeah, so she got into a car accident. She broke her hip. She fell and broke her hip. She fell and broke her knee or broke her arm. It only would cover that type of hospitalization. She didn't have sickness coverage. Wait, what? So she paid for this insurance for all this time, and we can't even utilize it, even though she was in the hospital for quite some time. So make sure you definitely, if you don't do nothing else, read that fine print before you start signing your name and ask questions and everything. Because, of course, insurance agent is trying to get the sale. So just make sure you know fully what you're getting, fully what's covered, just in case something happened, you won't be stuck with the bag. You already know what kind of coverage you did and did not have. Now, granted, it will be higher if you add on sickness, but I would rather you add on sickness to make sure you're covered than not have it at all. Okay. Okay. Life insurance. We all know we need life insurance. That is going to be coverage for the event of you passing, right? But it also can age with your value can age in a policy. So the difference is term life and whole life. Okay. And so before you sign this policy, make sure you read. For the people in the back, please read because you may think that you're having a whole life insurance, which is higher, but the term life has capped and it start decreasing and you're still paying the same amount of money. Okay. So the difference is term life is cheaper. It is simpler and it has an expiration date. So, and it does not include a cash value. So the terms are 10, 20, and 30, right? And you may get penalized if you passed before your term. Okay. So make sure, but it is the cheaper option. So most people get that. Whole life is more expensive, more complex, but provides a long term coverage, builds cash value over time. The longer you have it, the more better off you are. But you may also occur a penalty if your coverage lapse, meaning you pass before you the ever terms that they did set in there, if you have a lapse in coverage or something like that, and or untimely passing before the maturity of the policy. Okay, so of course, so they don't want you to get life insurance today and then you pass away 3 weeks later, because of course they got to pay out this money. So that money may not even be paid out because you didn't have it enough time to mature. Okay, so always get life insurance way before time, and it's going to cover your burial, any expenses that you may have. The money goes to your beneficiaries. And if your beneficiaries, if one of your beneficiaries happen to pass, that money also is divided to their heirs. So, for example, if for my grandmother passed, it was 8 children, but only 7 was surviving children. But the 8th child did have a child herself. And so that money, instead of being divided by 7 between my mom and her siblings, it was divided by 8 because my cousin got my aunt's share. Okay. And that, of course, caused a little unrest because you know how our family do about money, child. So, yes, make sure that you understand the whole beneficiary thing, right? So, make sure you go ahead and read all fine print. That is the main goal for here today. Get supplemental insurance, secondary insurance to add to your plan, to make sure that you have full coverage. Grab you some hospital insurance and some long term care insurance if you're older, to make sure you're covering and helping with out of pocket costs. And the life insurance is going to help for the burial. It's going to help. But a tip for your life insurance, you still have to have money, because once you pass away, it doesn't kick right in and cut a check, right? So the funeral home can kind of borrow against it in a sense, but you still have to put some money up. So that's why I told you last week to make sure you have a POD, which is payable upon death. So the money that is in that loved one's account, you can take that to put towards the burial. Because that's why, unfortunately, a lot of my black and brown people, we having fish fries. So please make sure the insurance is in order. It is very, very important. It causes to make sure that the stress is not on your loved ones in a crisis or untimely passing. And just make sure you really read the policy. I know it's long. The policy normally is like a whole bunch of pages and it looked like you're signing your life away, but I promise you definitely want to read it. You want to read it. So thank you so much for seeing me tonight. I greatly appreciate it. Next week episode is Get Your Mental and Emotional in Order. So it's going to talk about all that it goes into being a caregiver, like the mental aspect of it or the emotional aspect of it, and just mentally preparing yourself for that, because it is sometimes overwhelming and sometimes it is it make you want to pull your hair out, literally. So I'm going to be giving you different tips and things to help you through that process and preparing for that process. So I thank you for joining me tonight, and I want you to have a wonderful weekend, and I look forward to seeing you next week at Friendship Fridays at 9 p.m. so we can go ahead and get our mental and emotional in order. Have a wonderful day. Signing off from your favorite bestie. Bye.